Carter's symptoms before coming to this office, we had lots of problems going outside, just being a regular kid, just going outside and playing, and he would come back in, he would have spots all over him, he would have the watery eyes.
Asthma attacks, he'd get hives, he was constantly stuffy. It kind of breaks your heart, you know, seeing your kid that can't go outside and play, and then you've got one kid that's outside, so watching him think that something's wrong with him was the biggest factor with us. And you try to instill in him that nothing's wrong with him, it was just, you know, a part of life. You know, some kids are sicker than others, and, you know, trying to help him know that we're working, trying to figure out, you know, how to help him so he can get out there. We spent multiple trips to the doctor's office because of Carter's symptoms, and they got there, they knew Carter, as soon as he walked in the door, he went straight back, put on the albuterol breathing machines to get monitored and stuff. Then we had a couple of times that they called and we had to go straight to the ER and spend days at the ER.
It affected us because we couldn't go to the pool some days. I mean, just being outside, just around just normal trees and grass, and just him going to the park and playing, it was just hard for him to just be outside just with those environmental factors. We have two pets. We have, what are our pets' names?
Bella, Sophie.
Sophie, and every time you would get around them, what would happen?
Asthma.
His asthma would kick in. He would have a lot of hard time breathing. He would have the itchy, watery eyes.
When we went to the pediatrician, all they wanted to do was kind of cover up the symptoms and just treat the symptoms that he had. When we went the first visit to Dr. Robertson, he wanted to figure out what was the cause.
To assess Carter, Dr. Robertson did an allergy test and a breathing test.
The breathing test confirmed that he did have asthma.
The treatment that Dr. Robertson recommended Carter was Singulair and allergy shots once a week. Since being on allergy shots, we have not been to the emergency room any.
Hey Carter, what's your favorite part about coming to Dr. Robertson's office?
Getting the sucker.
What do you have to do to get the sucker?
Get the shots. Not inside anymore. No running noses. I can play with my dogs now. I can play outside with the other kids. Dr. Robinson is asleep to me. I try to make me feel better, not sneezy.